long-term care program rate cells. Right now in Wisconsin, the family care program only uses two, nursing home and non-nursing home. Typical rate cells can be blended where the nursing facility and the home and community-based services are combined, or you'll have standalone nursing facility, home and community-based services waivers, and you may even see potential age bands. So, little interesting piece of information, age bands help us differentiate risk. Risk is very closely correlated to age. So I'm going to pick a simple example. If you were to look at a morbidity curve, this is cost compared to age. When you're born, it starts out, you're pretty darn expensive. Then all of a sudden you get down to about age 6, and then it starts spiking. So if you're going to kill your kids, kill them by about age 6, because otherwise they start costing you a boatload of money. Okay? And it's a quick slide down a very muddy hill from that point forward. Okay? Same thing happens when you look at males versus females. Females have a lot more moving parts, and so at younger ages, they're more expensive. Yet females tend to be more durable. As they get older, they're less expensive when you compare them to men. That's why you see differentiations in age. Okay? Most programs, when somebody thinks about the risk of the program, all they think about is the clinical risk. They just focus on services. But that's too narrow a way of looking at risk of healthcare. Anybody in here from Sturgeon Bay? Okay. Anybody from Prairie du Chien? Okay. I'm going to guess. I've never been to Sturgeon Bay and I've never been to Prairie du Chien. But I'm guessing if somebody knocked you out and woke you up in Sturgeon Bay, you know you weren't in Prairie du Chien.
Probably.
Pretty fair to say. Okay. Anybody from Milwaukee here? Okay. Let's use the dead center of Milwaukee, right? Middle of downtown. If somebody grabbed you from that spot, knocked you out, and woke you up in either Sturgeon Bay or Prairie du Chien, would you know that you were no longer in Milwaukee? You'd wake up and you'd say, Dorothy, we're not Kansas anymore, right? Okay, so that's a simple illustration of saying if all I do is focus on services, I haven't adequately captured the risk of the healthcare program, because geography alone is a huge determinant. I would imagine, I haven't gone for DD services, habilitative services in Milwaukee, but I would venture to say there's probably a greater prevalence of PT, OT, group therapy, day treatment training programs in Milwaukee than there are in Sturgeon Bay or Prairie du Chien. Okay? Fair to say?
Yeah.
Wait a minute. That means if all we do is just focus on services and we don't take into account things like the network or the benefits available, we haven't looked at the full risk of the program. So what do? How do we look at the full risk of the program? We look at the 4 determinants of risk. This is how you make sure that you've ensured comprehensive actuarial analysis. And you know what you end up doing? This is what you should ask the actuary that's doing the certification. You should say to them, hey, have you factored in the program design, how people become eligible? Have you factored in who actually receives the services? Have you factored in what services they use? And have you factored in where they get those services? And if they look at you and they say, it's all in the cert letter, you need to say, you know what, I'm sorry, I'm a little slow. I apologize, I didn't understand that answer. Can you back up a little bit? Play Columbo on them. Anybody in here understand the Columbo reference? Okay? Just play dumb. Say, I'm sorry, I didn't follow that. Can you explain that to me? You need to feel comfortable that you understand each one of these, and if you can't explain how the rates they're setting incorporates your particular profile of risk according to these 4 determinants, then you need to say, these aren't actuarially sound rates for me, and I'm an economically and efficiently operated health plan, or I'm an economically and efficiently operated provider underneath that health plan. I represent the system of care that needs to be economically and efficiently operated. I know I'm meeting the access and quality of care standards. How many of you have looked at the contract that controls the state's relationship between Wisconsin Family Care and the managed care organizations? A little more, that's good. That's great. More of you need to do that. You need to understand, what are they being measured? Okay? What gets focused on is what gets measured, right? If somebody says your incentive program is based on increasing your number of individuals who are in some kind of day treatment program, I bet you're going to get more people on a day treatment program. Financial incentives, by definition, drive behavioral change. So we're going to go through each one of these four. All right. How? This is the first determinant. It really, the simplest way I think of it is, it's the eligibility process. How does someone become eligible for the family care program? Can I tell if someone were not eligible for the program? Can I tell the process?